Good day, everyone. I am Christine, the moderator for this webinar. I welcome everyone to today's webinar that is Medicare and Medicaid Regulatory Compliance Issues. I would like to introduce our presenter for today, Knicole Emanuel. For over 20 years, Knicole has maintained a healthcare litigation practice concentrating on Medicare and Medicaid litigation, healthcare regulatory compliance, administrative law, and regulatory law. She is a weekly panelist on RAC Monitor as a national expert on Medicare and Medicaid audits. I would now like to hand over the floor to the speaker. Over to you, Knicole.
Hello, how is everybody doing? I hope well. So today's topic is Medicare and Medicaid provider appeals. And we are going to talk about, here's our agenda. We're going to introduce you to Medicare and Medicaid appeals. We're going to give some common reasons for denial in audits. And we're also going to talk about how to rebuke that. And we're going to talk about debunking denial reasons and case studies, legal framework and citations, and then tips for a successful appeal. So here we go. We're going to start off with introduction to Medicare and Medicaid appeals. And so the Medicare overview is that, as you know, Medicare is a federal program. Medicaid is a state program. A provider, how do we get to the appeals process first? Let's ask that. So you're a provider and you are audited by the state or federal government. If you want to know how important provider appeals are, it matters so much. I am very happy to say that in my 25 years of doing this, I've only seen, and it shouldn't be only, but I've only seen 4 to 5 facilities go under because of these post-payment reviews. You need to receive equitable treatment and reimbursement processes. Also, it impacts patient care. And you want to make sure that providers have financial stability. Now, there was in the past a really big backlog, and I will explain what I mean by that. This is a Medicare provider appeals backlog and wait times 2010 to 2023. Now we're going to get into common reasons for denials in audits. All right, documentation is the first line of defense. It's not just paperwork. It's the foundation for claim approval. Inaccurate or incomplete records, that's among the top reasons why claims are denied or delayed. Common errors include missing information, incorrect codes, unclear descriptions. Now, this will also contribute to claim denials. Well, you need to double check everything before submission. Now, medical necessity is crucial for claims approval. Medical necessity is the gatekeeper for claim approval. Providers must be familiar with local coverage determinations, or LCDs, and national coverage determinations, or NCDs. And remember the old saying, if it's not documented, it didn't happen. Now, coding and billing discrepancies. Errors in coding can result in significant denials, affecting revenue and workflow for healthcare providers. Now, ICD, CPT, and HCPCS updates must be reflected in these internal audits. Staying compliant means keeping staff trained, documentation aligned, and systems updated to avoid costly discrepancies. Now, best practices is going to be to implement real-time coding. Now we're going to move to debunking denial reasons. This happened a lot during COVID, the impact of not seeing the patient face-to-face. Now, examples of educational mismatches. So I want to talk a little bit about some successful appeal stories. So now we're going to go to the legal framework and citations. These are the important regulations or acts that pertain to Medicare and Medicaid provider reimbursements. You should really stay apprised of recent case law to understand the appeal process and its outcomes. Legal strategies for effective appeals. Tips for preparing a successful appeal. Gathering comprehensive documentation. Crafting a compelling argument. Best practices for submitting appeals. All right, we're going to get into the conclusion here as we went over all our topics. We went through and understood Medicare and Medicaid appeals process. Now let's move on to super recent, very recent things that have just now impacted Medicare and Medicaid. As I discussed, the HHS, Health and Human Service, and OIG workforce team are going to focus on compliance and enforcement. Now, implications for healthcare providers with a history of compliance issues are at higher risk. Well, I hope you guys appreciate it or like this program. I hope you now understand the appeals process. I hope that you enjoy this presentation. You should appeal every single audit.
Thank you, Knicole. That concludes the session for today. Thank you everyone for participating. You may all disconnect now and have a great day.
Thank you.